Okay, why don't we go ahead and get started. Thank you everybody for joining us today, Monday morning, for our Team 19 Miller-Johnson COVID Response Team Roundup webinar series. Today is Monday, May 17th, and had some news here in Michigan breaking at the end of last week. We thought this might be a relatively slow webinar midweek last week. I don't think that'll be the case now. Unfortunately, we have Sandy and Tim, who I was joking with late last week. I wouldn't take any action COVID related without consulting them on the legal side. There are really our go-tos internally along with their colleagues in their respective sections, but they've just been on top of all the orders and the statistics for the back to normal plan from the beginning. And so to the extent that they can, and there's a little uncertainty, they're going to cover some of the breaking developments from the last 5 days here. And I will begin separately with a very brief, because I think people are more interested in what Sandy and Tim are going to share out. But I will begin with a brief overview of Treasury Department's rulemaking on the state and local recovery funds generally. I'm going to focus on some of the essential worker premium pay provisions, since we have covered those previously through Miller-Johnson, and I think it's something that a number of clients have expressed interest in following. Some of the other topics are very important in that rulemaking, but may not be as relevant for kind of private sector clients and community participants. And then after that, I promise I'll get through that quickly. We'll get to the updated MDHHS order and new COVID-19 vaccination requirements for nursing homes, and have a discussion around those topics and take some Q&A around those. So why don't we jump right into it? And thank you again for joining today. We really appreciate it. My name's Erik Daly. You can see there's a nice pre-COVID picture of me. My contact information is available if you want to follow up on this or any of the kind of small business funding topics that we've covered through our COVID series. So the American Rescue Plan Act, ARPA, authorized about $350 billion in state and local fiscal recovery funds. And the ARPA provides that state and local tribal governments, non-entitlement units of government, can use their portion of those funds in certain specified categories. And so we're going to focus on one of those in particular today. But just to kind of break down where we are in Michigan on the funding, there were some preliminary allocations that were announced maybe a month or so ago of expected funding. And Michigan's share of the overall funding actually increased relative to the preliminary expectations or preliminary estimates. So based on the latest information I have seen, and that's available on Treasury's website. And if you go to the Treasury Department's website, and when I'm done speaking, I'll link to this in the chat just in case you're interested. You can see a breakdown of the funding allocations by state, by county, and by major metropolitan area. So, if you're in Grand Rapids or Kalamazoo or Detroit, you can see the funding levels for each of those cities and the relevant, kind of surrounding counties to get a sense of the infusion of funding that's coming for state and local governments around Michigan, or if you're elsewhere, you can look, see wherever you want in the country, kind of what the amount that's going to get to the state and local level is in any particular area. So about, here in Michigan anyway, it's about $6.5 billion for the state, so state level funding, and then the remainder of the $11 billion, so $4.5 billion, is designated for counties, major cities, tribal governments, et cetera. And of that, the area in the state naturally that you'd expect that's receiving the most of, or not the most of that 4.5 billion, but relatively more than other areas is, around Southeast Michigan, so Detroit, Oakland, Wayne County kind of area, but Grand Rapids, Kent County, and the Kalamazoo area are also receiving quite a lot of money under the final allocations as well. So that's sort of the context for Michigan. And then the key categories of permissible uses for this funding. Again, we're going to focus mainly on one of these, but naturally it's providing support in response to the public health expenditures that have been incurred and will continue to be incurred, dealing with the economic fallout from the public health emergency, replacing lost public sector revenues in certain communities or at the state level due to the decline in employment and economic activity, especially early on in the pandemic. And then for today's topic anyway, premium pay for essential workers. And then lastly, and this last one is not as immediately tied to the current COVID situation, although there is a connection, especially for broadband and some of the other categories, but investing in water, sewer, and broadband infrastructure. The Treasury interim final rule that was released, I think last Monday, provides some additional guidance and principles, basically, for state and local governments to figure out what types of programs and services qualify for each of these different major categories of spending that are permitted under the ARPA. And it also includes some areas of ineligible uses. So, you might be aware that in general, state and local governments can't use these funds, for example, to replenish rainy day funds or fund tax reductions. So the IFR goes through each of those topics in some level of detail as well. But again, not really the focus of what we're going to go through today. But if you're interested, again, I'll kind of link to the Treasury page that has some of that information if you want to look at it. We may do some future programming that's more generally relevant to the ARPA state and local funds. But on the premium pay issue, just as a reminder, this is what the statute said. So the actual American Rescue Plan Act said one of the permitted uses of that $350 billion is premium pay, or, that's what it's called in the statute, but some people might call it hazard pay, things like, bonus pay for people who came in and worked in person, stuff like that. And what the statute authorizes up to $13 per hour, incremental $13 per hour to eligible workers, quote unquote, which is a defined term in the statute, with a $25,000 per worker cap. And that amount, as I just alluded to, that $13 per hour and that $25,000 per worker cap, that's in addition to kind of the existing wages or compensation of the eligible worker. And potentially it's for any and all work that the worker performs or performed, past tense, during the COVID public health emergency. So that's statutory definition. And then the statute defines eligible workers quite broadly as workers needed to maintain continuity of operations of critical infrastructure sectors as designated by each head of state or local unit of government. So basically, in the statute, the eligible worker definition and how this money for premium pay, if any, is approved or used is largely left to state and local heads of those units of government, and subject to whatever rule or lawmaking they might have to navigate to implement the spending measures or any kind of private grants to employers to fund premium pay. There's no requirement that the job was previously designated as quote unquote essential, or that the industry was previously designated as critical infrastructure. And as I said, lots of discretion under the statute. And then, so we have the statute, now we have the interim final rule, which does provide a little bit more, some guardrails for the use of that fund, maybe we can say. So it's not quite as open-ended. It's still quite flexible, but not as completely open-ended as we might have thought based on the statute alone. So Treasury came out with the interim final rule and said, they affirmed some things like it can be paid directly to essential workers who work for the government, right? That was pretty clear. And then the statute was also quite clear that the premium pay could be funded by grants to private sector employers. So that is retained. There's some public disclosure requirements that Treasury includes in the IFR in particular for grants to private employers. So you'd expect those things to be part of the public record, and that's just really affirmed, and the mechanics for that are affirmed in the interim final rule. But there's no approval process per se for that in advance, designating which private employers, as long as it kind of falls within the rest of the IFR that I'm going to go through here. One key additional substantive measure, and it's not a hard limit necessarily, but the IFR says that the premium pay, you're not allowed to use that to increase an eligible worker's total pay above 150% of the larger of the state or county level average annual pay, unless you provide a specific public justification for doing that. So again, this is not a statutory requirement. It's a new kind of guardrail put in place by the interim final rule, and it doesn't necessarily prevent workers from receiving more than that, but it does require some additional specific justification should a state or local government create a program that would have that effect. Employers and the government cannot use this fund to reduce or substitute for a worker's other normal earnings. So, you can't say we're going to use $13 an hour of premium pay and we're going to reduce your hourly wage rate to $3 an hour or something like that. So it has to all be completely incremental to kind of the existing base wage. And importantly, the last point, I think this is pretty clear from the statute itself, but Treasury went out of their way to emphasize not only that the funds can be used retrospectively to fund work from the outset of the COVID-19 public health emergency, but in fact, Treasury encouraged or urged governments to consider doing that, since many of the eligible worker industries were not able to do that necessarily at the outset of the pandemic. And so they definitely view that as a permitted and in fact encouraged use of the funds. And then in terms of eligible workers, one kind of requirement that wasn't specifically in the statute, but Treasury implemented through their rulemaking, is that any individuals who receive the premium pay must have been involved in regular in-person interactions or regular physical handling of items that were handled by others. So basically remote work, telework, probably is going to be ineligible. There might be some exceptions for public safety or health, government employees, but for the most part, like grants to private sector employers, those can't be used for telework or remote workers for the most part. And then one additional clarification was that staff working for third-party contractors in eligible sectors may also be eligible for premium pay. So, for example, if a government, like a local city government, for example, contracts with sanitation, privately owned sanitation business for trash removal or something like that, I believe the IFR is saying that those third-party employers working for that contractor would be eligible even in the absence of a grant to that private sector employer because they're contracted by the government to the city or local county government, whatever it might be, for one of the eligible industries. I'm going to continue to move along here so that we leave enough time for Sandy and Tim to provide their updates. But some examples of eligible sectors and industries, and this is pretty close to everything that Treasury called out. I didn't include in every single industry because there are some niche ones like biomedical research is on there, but it's in the rule, kind of what sectors are eligible. It's fairly lengthy, but as you'd expect, it's largely health related. So nursing homes, hospitals, pharmacy, food and food production, food supply chain, restaurants, janitorial, sanitation, laundry, transit, logistics, things like that. Obviously, public health and emergency response, safety staff, childcare, educators, school staff, social and human services. And then, like I said, there are more examples included in the IFR. And then the Treasury Department did, leave open that this is a non-exhaustive list. These are presumptively eligible for that premium pay, subject to the other rules around 150% of the state or county wage level and things like that. But the chief executive of a state or local unit of government could supplement this list with others that qualify as long as they involve in-person work or handling of physical items from some kind of in-person activity. And actually, I think some clients know Miller Johnson has been involved in helping to provide some constituent feedback or facilitating constituent feedback at the state level about areas where premium pay could be particularly useful. And interestingly, not that we had anything to do with that list aligning with the groups we provided feedback on but it does largely align with the clients that we've seen come forward and say, yeah, we think our employees were essential workers, and we'd like to communicate that to the state. So if you have a similar situation, you can reach out to me or my colleague Hillary Skolton, who have been kind of working with clients to make sure we collect that feedback, and we can help set up constituent meetings if you want to urge your local representatives to consider your employees. And in fact, Treasury has, in their rulemaking, told state and local governments that they, are strongly encouraged or urged to engage constituents and communities in developing those plans. So there's nothing, inappropriate about that. There's obviously rules that apply when you're communicating with lawmakers, so you want to make sure you do that appropriately. But Treasury would like state and local governments to engage with their communities in figuring out how to spend the monies, the appropriations. And then just really quickly, other observations, separate and apart from the premium pay provisions, just because this is something that I've followed, I wanted to kind of note it for people. The IFR, the interim final rule that Treasury put out, does empower state and local governments to kind of create their own sort of mini PPP or similar grant programs using some of the same standards that the SBA does for small businesses, quote unquote, and permitted uses. So that's something to keep an eye on, whether whether the state of Michigan or other parts of the state, cities do anything like that. But that would be allowed. And then kind of related to that, the ARPA funds can be used by state and local governments to support and provide aid to the tourism, travel, and hospitality industries, specifically approved those industries under the IFR, but also to any other industries that a state or local government official determines have been similarly adversely impacted. So there's some metrics related to the tourism, travel, and hospitality in terms of like percentage impact on employment and production. So if there's another industry in the state or local area that has been similarly impacted due to COVID, and it has to be due to COVID and not just kind of a general decline in that industry, the funds can be used to support that that use as well. And then I'm wrapping up here. The Treasury IFR creates some periodic reporting requirements for transparency, as I kind of alluded to before. So, you know, it's not a black box where $350 billion just gets spent without public visibility. There's quite a lot of visibility that will be provided actually under the rule. And then lastly, just a couple of points to emphasize, you know, any spending of the ARPA funds on things that are borderline or not clearly approved by the rules really needs to be tied to the adverse impact of COVID, the pandemic, rather than kind of more generalized hardship facing a business or an industry, say. So, you know, if you're not specifically called out as the potential recipient or as an approved use of these funds, but you believe that COVID has had an impact on your industry or on your workers, I think, again, you can reach out to us and we can talk about it to see if there are ways to provide that kind of constituent feedback to help, you know, kind of create a record that that's the case. And with that, I think I'm going to try to wrap up here. I'll keep an eye on the Q&A to see if anybody has questions and drop in that Treasury link. But now I want to turn it over to Sandy and Tim to talk about what people are probably a little more curious to hear about in regards to the MDHHS order and other related issues. Sandy?
Hi, thanks, Eric. Yes, what an eventful couple of days. As Eric said, we were talking amongst ourselves going, gosh, what are the updates going to be for Monday? And boy, we have them for you. So go ahead and go to the next slide here. This is just a quick look at how I spent Friday afternoon and maybe how a lot of you spent Friday afternoon, right? So for those who maybe joined us for the webinar on Friday morning, Sarah, Willie, and I talked to you about some late kind of breaking CDC guidance that was issued pretty late in the day on Thursday related to kind of expanding the types of things that fully vaccinated individuals can do. And one of those was resuming activities without wearing a mask. Even indoors, right? Except where required by federal, state, local, tribal, territorial law, rules, regulations, including rules of local businesses and workplace guidelines. So on Friday morning, we were talking about okay, the new CDC guidelines say this, but remember, we still have this MDHHS order, at least for folks who have employees in Michigan, and we still have the MIOSHA order that require masking. So even though we think maybe we'll start moving in that direction, hold for now. We've got compliance obligations under those two orders. But then, go ahead and go to the next slide. Later in the morning, after Sarah and I were done with our webinar, we had a press release from the governor's office related to the CDC guidance. And the title, right, was fully vaccinated Michiganders no longer required to wear a mask or face covering indoors or outdoors. And we thought, oh my goodness, well, here we go, right? We're going to get a new MDHHS order and we're going to get some revised MIOSHA rules and we're going to be off and running. What a great way to start the weekend. And so as we looked through the press release, we saw, okay, outdoors mask is not going to be required regardless of vaccination status. So we kind of breadcrumbing a little bit, at least one of the changes in the potential MDHHS order. We knew the outdoor masking in groups less than 100 people, that was already the existing order, but this looked like it was an expansion of that, okay? And then it talked about indoors. Masks will be required unless folks are fully vaccinated, but on July 1st, the indoor mask mandate will expire. And we thought, well, hot dog, that's great. And talked about a new MDHHS order was going to be issued, and it was going to take effect on Saturday morning at 9 o'clock. And so we thought, fantastic. Go to the next slide, please. But then I kept reading that press release, and you know that I'm an attorney here in our labor and employment section. And so, you know, I'm always thinking about, okay, well, what about employers? What about employees? What about workplaces? Any mention of MIOSHA or any of those groups in this press release? And not a one mention of that. And so I thought, okay, well, we'll just wait and we'll see what it looks like. So next slide, please. So pretty late in the day on Friday, the updated MDHHS order was issued, an updated gatherings and face mask order that was scheduled to take effect this last Saturday morning at 9 o'clock. And keeping with the same expiration date as the previous order. So May 31st, this is our order, right? Unless we know that these orders can be updated and revised even before that expiration date. We've gotten pretty used to that. But that's the expiration date on the order so far. So we quickly and thoroughly took a look to see, okay, what do we have here? What's the interplay? And so we know that for a long time, workplace gatherings have kind of been excluded from the gatherings definition in the gatherings and face mask order, as long as those gatherings happen consistent with the MIOSHA rules. And so there was no change there related to gatherings. But of course, the big news, right, is related to the face mask requirement. And so you may remember that in the previous order, it was just a general face mask requirement, and it listed, right, all of the situations where a mask is required, and then had a list of exemptions. So now that order is simply indoor face mask requirement, right? So it's changed that verbiage a little bit. And we've added to the list of persons who are exempt from an indoor face mask requirement, fully vaccinated people. So that is consistent with what the CDC says. But I'll be honest with you, the real puzzler for me came in this next section. It's for those who may have the order, and of course we'll have that up. It's section 6, sub B, that talks about individuals who are responsible for an establishment, so a business, right? I'm just kind of going to use that term broadly, facility, business, whatever the situation is, are still required to prohibit gatherings of any kind at their establishment unless that person makes a good faith effort to ensure that all persons at the establishment, including employees is included in the order, that exact wording, must comply with section 6A, which section 6A is you have to wear a mask unless you're one of the exemptions listed in the second section, okay? So if we go ahead and go to the next slide, the order goes on to talk about what is a good faith effort. Okay, if I'm a business owner, for example, right, I am responsible for this establishment. I now am required by the MDHHS order to prohibit folks from gathering here who are not wearing a face mask unless I make a good faith effort to make sure that they are excluded or whatever this good faith effort is to comply. So the order defines good faith effort in a way that an establishment owner or representative, right, can comply with their obligations here. They can post a sign notifying people that wearing a mask is required unless the person falls into a specified exemption. They can ask patrons who are not wearing masks whether they fall into a specified exemption. And remember, fully vaccinated status isn't the only exemption, of course. There are folks who are younger than 2, someone who cannot medically tolerate a face mask, people who are eating or drinking, you know, all that list of exemptions. Or it can still require masks of all patrons and employees, said the word employees in there again, or any other policy designated to ensure compliance. So essentially what the order is saying, if you're a representative of an establishment, you have some obligation to try to make sure that people who are in your establishment, if you're indoors, right, who are in your establishment, who are not wearing a face mask are fall into one of the categories listed in the exemption. Okay, that's essentially what this is saying. But the big issue here, of course, and I know that you all know this based on the questions that we were getting prior to this webinar, so I know you're on it. Let's go ahead and go to the next slide. Is of course we have existing MIOSHA emergency rules, right? So we know we have these rules in place, and right now, as written, they're effective through October 14th, 2021. That's a pretty long time from now. And there are several rules, right? Several sub-rules. I generally call them rules, but it's a listing of rules, right? Several rules that specifically require employers to require employees to wear face masks. And additionally, there are several portions of the MIOSHA emergency rules that require employers to require patrons or patients or clients or customers to wear face masks, and there's no mention of vaccination status being an exemption for that requirement, right? So just to draw your attention, Rule 7.4, for those who have been operating in person, you probably know these like the back of your hand, but Rule 7.4 requires employers must provide face coverings to their employees at no cost, right? Rule 7.5, the employer must require face coverings to be worn when employees cannot consistently maintain 6 feet of separation. In Rule 7 sub 6, the employer must require face coverings in shared spaces, right? So hallways, restrooms, cafeterias, meeting rooms, all of those pieces, right? And no mention of vaccination status. And on the webinar on Friday, we talked about that a lot, that even though the CDC guidance now has these carve outs for fully vaccinated individuals, at that time, the MDHHS order did not, and the MIOSHA order did not. So we've, right, the MDHHS order does now, but the MIOSHA order still does not. And when I talked about industry specific requirements, right? So if you are listening and you are in retail, libraries, museums, restaurants or bars, healthcare facilities or agencies, personal care services, and places of public accommodation like sports and entertainment facilities, such as arenas, cinemas, concert halls, performance venues, sporting venues, stadiums and theaters, as well as places of public amusement, you have specific requirements in the MIOSHA rules that require patrons or customers to wear face coverings. So let's go ahead and go to the next slide. So what to do about this, and what seems to make the most sense here. So I don't have a great answer for you this morning, but I'll kind of point out what the appropriate analysis is, right? So at least as we look at these two orders that we know that we've been subject to, if you're in Michigan, right? If you're here in Michigan, you know you're subject to these two orders. There appears to be some conflict between them, or at least not congruence between them, right? They're not maybe necessarily at odds, but they're not saying the same thing, right? And so when there is conflict, right, there is risk associated with following the least strict standard, right? So if you are somebody who is subject to MIOSHA orders, and you make the decision to follow the MDHHS order on the, and exempting fully vaccinated folks from masking where you otherwise are required to, there is some inherent risk there, because that's not exactly right what the MIOSHA order says as of today. And trust me, I've refreshed my screen about 10 times just to make sure we didn't have any late breaking news to share with you. So with that incongruence, with that conflict, again, there's some inherent risk. And so as a business owner, it's important for you to reach out to your individual attorney, right? And evaluate how that risk applies to your specific situation, because there's a number of factors that can play into into your ultimate business decision on that, and those are not going to be the same across all businesses. But as we sit here today, the MIOSHA order is unchanged, and we are hoping that we will hear from them soon. But we recognize that this creates a lot of dissatisfaction for our employer clients. And anecdotally, as we were before the presentation kind of sharing our own experiences this weekend, it kind of seems like this is kind of how businesses are proceeding, right? It's a little bit of a hodgepodge. Some clearly recognize that there's some inherent inconsistency between these two orders, and so they're taking the conservative approach and just saying we're going to keep requiring everybody to mask because we're not really sure that we're actually really allowed to allow people to be unmasked here indoors in our establishment, even if they're fully vaccinated. So at the end of the day, the MIOSHA order still does require employees to be masked when they can't maintain social distance and anytime they're in shared spaces, and require the employer to require that. We hope the MIOSHA orders will update soon. And we had one more question prior to jumping on today. When we're talking about vaccination status and requesting that information from employees, yes. If you are an employer, the EEOC has said that is something that you can ask your employees. That's not considered a medical inquiry under the Americans with Disabilities Act. Just by asking if your employee is vaccinated and asking for proof of vaccination status. And then a few other questions specifically related to, I'm this kind of business, what do I need to do? So I would just encourage you to go back to the MIOSHA rules and see if you have industry specific requirements as it relates to whoever your customer is, right? If it's a patient, if it's a client, if it's a customer, all of those pieces, those are spelled out pretty well in the MIOSHA rule. And with that, I'll turn it over to Tim, but I will keep an eye on the Q&A and respond to any questions that fall in this area that we can answer.
All right, thank you very much, Sandy. Just to sort of hop on before I jump into some of these new requirements for the nursing home, I just went and looked over at the state dashboard, and we're up to 55.7% of the 16 and over Michiganders vaccinated. So as we kind of put in our newsletter on Friday, we're significantly slowing down in the initial vaccination dosages. So it's obviously at this point a combination of these new mask and gathering orders along with these different steps. So, we'll continue to send those updates on Friday and provide updates on Monday as they come up. But it looks like it's going to take us a while to continue to move up towards that 70%. All right, Eric, next slide. So on May 11th, CMS issued some new interim final regulations. There are 90 pages of regulations, primarily addressing infection control requirements, and specifically within the infection control requirements, it was discussing the education and administration related to COVID-19 vaccinations. Obviously, I'll get into some more of the specifics here. In addition, they also released a memo on these new regulations addressed to state survey agency directors, which provided a little bit more detail for, nursing home administrators as to, what they can expect. How is this going to be evaluated when surveyors show up at your facilities? One other thing is the regulations mentioned or stated that they will start 10 days, will become effective 10 days after the publication of the interim final rules or regulations rather. Again, that occurred on May 11th. So, there's another 4 days here until those go into effect. So hopefully, some of you all started working on these already. If not, we're happy to help. The goal here today is to provide you, a little bit more detail into these, and hopefully, that will help you as you start writing policies and start preparing to address these new requirements. Again, so this applied to long-term care facilities, nursing facilities, skilled nursing facilities, and also to intermediate care facilities, ICFIDD, so intermediate care facilities for individuals with disabilities. the intent here is what CMS made very clear. The intent is to pick up where the pharmacy partnership program leaves off. So as many of you are familiar, especially those of you who are long-term care providers on the call today, the pharmacy partnership was a way to get vaccinations out quickly to nursing homes, which, as we're all aware, have been hit very hard by COVID-19. This is an extremely vulnerable population. And so the government really prioritized getting individuals and staff in nursing homes vaccinated. However, this is a temporary program. It is not a permanent program. So these new regulations add additional requirements on nursing home on a move forward basis. So the anticipation is we're going to be dealing with COVID for the foreseeable future. The partnership program is not permanent. These requirements are permanent, and on a move forward basis, this is going to be how CMS expects nursing homes and other congregate care facilities to address the sort of COVID-19 issues they're going to continue to face. So again, as I mentioned, really the emphasis here is on, it's kind of threefold, I guess, vaccine education and reporting, and also administration. So the first component here, offer and provide vaccines. So the requirement applies to both staff and residents. It's only applicable when supplies are available. Obviously that sort of makes sense. We'll kind of get to some of that in a little bit more detail about how important it's going to be if you're claiming that there are not supplies available, it's going to be important to document that. The CMS did give long-term care facilities, congregate care facilities, the options to either provide the vaccines directly or to do so indirectly, meaning you can partner with pharmacies, health department, other healthcare providers within your area. So, there's a lot of different entities that are providing vaccines at this point. Obviously, public health departments foremost among them. Pharmacies continue to provide that. And hopefully will continue to do so in the future. So it's possible for long-term care, congregate care facilities to partner with one of those entities. Alternatively, they can enroll with the government's vaccination program themselves and have vaccines given, provided to them directly. We provided a number, probably 3 months ago or so, maybe longer at this point, a PowerPoint that talked about some of the considerations, the agreements that you have to, the enrollment applications, et cetera, that you have to enter into to become part of that program and what that means. So, if you have questions related to that, if that's something you're considering doing this directly, please reach out to me or one of your other Miller Johnson attorneys, and we can help make sure that you understand what that means and how you can go about implementing that. Again, the other aspect that I mentioned is going to be COVID-19 disease and vaccine education for staff. Again, this applies to staff that regularly work in the nursing homes. Now, for those who are, obviously nursing homes have been testing people for quite a while now for COVID-19, and they're required to test staff. The staff is defined differently in the testing context, because of course we can't make this simple on you all, than it is in this context of providing vaccine education. So in this context for education, it means regularly means at least once per week. So if you have, for testing purposes, if you have someone come to repair air conditioning or plumbing or something like that, and they end up coming every few weeks, staff testing was still required. However, you would not be required to educate those individuals. However, say you have a doctor who regularly does rounds on members of your congregate care facility, as if they're coming at least once per week, then you're going to be required to provide education to them. And as we'll get in, as I mentioned in the next couple slides, you're going to have to be able to document and prove that that's occurring as well. Again, so specifically, they were quite specific in the regulations. As I mentioned, they were 90 pages long. And while the concept of educating staff or residents or clients, depending, and their representatives, seems fairly simple, they provided a fair amount of specifics. So again, the education is going to have to cover risks, benefits, and side effects. So the benefits under the regulations, they specifically mentioned that the benefits of vaccination include reduced risk of illness, reduced risk of severe outcomes such as hospitalization and death, as well as reduced transmissions. With respect to risks, they said, risks should be, when you're educating people on the risk, you're going to mention the common side effects such as aches and fevers. You're also going to discuss rare reactions such as anaphylaxis. You're going to want to educate on how, these reactions, the severe side effects are relatively rare and there's just a low level of them. You're going to have to continue to monitor the information and education we get about these vaccinations. Again, as we're probably all familiar with, there was the Johnson & Johnson vaccine. There became concerns about blood clots. There was a hold placed on, there was an investigation, the FDA looked into that and then provided additional information. So those sort of incidents or those sort of developments, you're going to have to then incorporate those into your education. Again, education should address ongoing vaccination opportunities as well. So, obviously people, nursing homes and other congregate care facilities are pretty familiar with educating on infection control, a whole host of topics, HIPAA, any other number of areas that staff need to be educated on. And so, you're going to have a PowerPoint presentation, some other training materials, and included in that, you're going to want to provide a list of ways that staff and residents can get vaccinated as well. Again, this is going to be something you need to provide to new staff upon, being hired. Probably going to include this as part of your typical orientation, but you're also going to be required to provide this on an ongoing basis to existing staff. So, maybe it's once every 6 months, maybe it's once a year, but you're going to want to show that you're continuing to provide this education. You're also going to want to develop, this was talked several times in the regulations, develop policies and procedures must be part of the infection prevention and control program. So these congregate care facilities already have infection prevention and control programs. And so this is going to be another component of that. It's going to be COVID-19 specific. Again, it's going to discuss administration, availability of vaccines. It's also going to discuss this education component as well. So you're also, in addition to educating staff, you're going to educate residents and resident representatives in the nursing home context, in the in the interim care facilities. You're going to want to, it's going to be clients and client representatives. Again, it's going to be, this is repetitive. It's going to be educating the staff on the risks, benefits, and side effects. Consent is going to have to be documented. You also have to permit residents and representatives the right to refuse the vaccination. And this is going to be where education and documentation are both important. As part of informing residents and representatives about the vaccination information, educating them, you're going to have to, one component is going to be to tell them that this is free of cost. There's no out-of-pockets, no co-pays for either for the residents. And again, it's important to not just limit this to residents or clients. As you are all aware, it's often that there's a guardian in place, or in intermediate care facilities, they might be minors. And so consent has to be obtained from the guardian, the parent, whomever has the legal right to provide that sort of consent. And so you're going to have to educate those individuals as well. And then when you're administering the vaccination, you're going to need to document that within 24 hours. Another component here that we'll address is that you're going to have to document and record and report the vaccination status of staff and residents or clients. Again, so education and reporting, long-term care facilities as well as intermediate care facilities are required to report vaccination status of staff and residents through the NHSN. Must report, and this is the terminology they use, vaccination status and related data elements. It's not exactly, they didn't let us know what else those data elements might be. I'm sure that'll probably develop over time as well. But at the very least, you're going to have to be reporting who has been vaccinated and who is not. It's going to be cumulative. That way, CMS and the other government entities can keep track of that information. and can kind of note trends as to where there are outbreaks, what's the vaccination level in these facilities, are there particular areas where we have a low level that we need to provide targeted education to, issues like that. In addition, there's going to be reports regarding COVID-19 therapeutics. Again, therapeutics was defined very broadly to mean treatment, therapy, or drug. The only example that they gave within the regulations about what was a therapeutic was monoclonal antibodies, which people are probably familiar with at this point, that have proven pretty effective in if given early on in someone who's been diagnosed or who has COVID-19 tested positive. The data is going to be reported weekly, and not only reporting this, but the facilities are encouraged to A, report this, and B, keep track of it on their own to track coverage, adjust communications as needed. Obviously, if everybody's vaccinated, you can relax a little bit. If you're noticing a particular, set of people, you're having trouble getting them to get vaccinated, then you're going to want to talk with those people, identify their concerns, and try to gear communications towards educating them and ideally getting them vaccinated. Again, the same requirements apply to ICFSs and /iids's. Again, you're going to have to offer vaccines to staff and clinics. You're going to have to educate staff and clients. You're going to have to educate staff, clients, and their representatives. The regulations discuss how ICFs are going to be required to follow CDC guidance on monitoring of clients, quarantine, et cetera. Again, I think people are familiar with that at this point. Kind of the newer component of all this is going to be documenting, providing the education, providing the evidence that you're helping people become vaccinated, documenting that they are vaccinated within the medical records for clients, or in the nursing home context, residents, and probably in the personnel file for staff. Obviously, you do not have a medical record for staff members. And so you'll have to find some other place to document that so that A, you can monitor it, and B, you can provide it to the government as required. So the other component here, if you could go back one more slide, the interim regulations address enforcement and survey guidance. Again, so they said the enforcements will be similar to requirements for flu and the pneumococcal vaccination. Again, so I think while this is new, these facilities are familiar with the requirements of about educating people. They're familiar with a lot of the infection control requirements, and to some extent, they're sort of doubling up what you do for the flu and pneumonia for COVID-19, applying it in that context. Again, failure for reporting the data or providing education could be civil monetary penalties. In discussing, the enforcement and survey process, the policies and procedures, you're going to need to have those in place to reflect vaccination administration and education efforts. As I mentioned, resident, client, and staff records must also demonstrate compliance. This is the one I kind of teased way back in our first slides. If vaccines are not available for one reason or another, that doesn't seem to be an issue at this point, but who knows moving forward what our brave new world will be like. You're going to want to have documentation showing that you tried to find vaccines and not, and that you made a pretty significant effort. You're going to want to have emails. If you're having conversations with public health department or other healthcare providers, you're going to want to document those phone calls in some way. I would recommend including those documentation requirements within your policies and procedures. And again, kind of as I mentioned early on, I'm happy to help. We have a couple other, individuals here, other colleagues that work pretty regularly with nursing home clients or long-term care facilities, intermediate care facilities. We're happy to help you draft those policies. We're happy to help you kind of go over our recommendations for documentation as well to put you in the best place to handle these surveys. Next slide. And we can also obviously help you develop training materials as well. Surveyors are going to request a point of contact. So you're going to want to identify someone within your facility, within your organization, who is very familiar with the policies and procedures and what you're doing with respect to COVID-19 vaccines, so that those individuals can kind of be that point of contact when surveyors show up. You're going to have to provide samples of education and informational materials, along with a list of vaccinated residents, clients, and staff. Surveyors are going to interview staff and resident clients and review a random sample of records again. So this is where the education is important. We've all experienced surveys where surveyors come in, they talk to a staff member. They're like, oh, are you educated about X? Have you talked about X? Do you know what your facility's policies are on Y? So we're going to need all our staff to be well educated so that when a surveyor comes up to them and says, you know, have you been educated, or do you know what the policy and procedure is for COVID-19 vaccinations, that they answer yes, and they can provide that they've been educated and they know what the risks and benefits are, that sort of thing. And that's where I usually see surveyors, you know, people get dinged on surveys, is especially when those employees or residents are interviewed. All right, I think that's the last slide. If you guys have questions, obviously, please reach out to me on the nursing home issue. Please reach out, as Sandy had mentioned, to your Miller Johnson employment lawyer or industry kind of area specific expert as far as how to handle some of these masks. We'll keep you updated on the MIOSHA. So I suspect we're going to have another webinar where Sandy talks to us about hopefully some new MIOSHA changes.
Yeah, this is Erik again, Erik Daly from Miller Johnson. Thank you, Sandy and Tim, for both of those helpful overviews. I believe if folks want to look in the Q&A briefly, Sandy has answered a number of questions. There was one question in my area which I may not have, in my area being the premium pay, or the prospect of a premium pay program for eligible essential workers and businesses. Right now in Michigan, just to be clear, and the question was, you know, how do you apply for your employees? Right now in Michigan, there's no program yet. So the state or a local unit of government has to create a program and implement it, create an application process, if any. They're not required to, but if they do, and they might do that if businesses or industry groups provide constituent feedback about particular industries, et cetera, then that's where you would look for the application process. So right now there's nothing, no proactive steps other than providing feedback to your elected representatives that, you know, you would need to take on that premium pay issue. I just wanted to clarify that, since it wasn't maybe completely clear from my earlier segment. With that, unless Tim or Sandy, if there's anything else you want to address based on the Q&A that's come in.
Sure, I'll just quickly address two quick questions. So there's a question here related to a distinction between an individual who's vaccinated versus an employee who has had COVID and has the antibodies but is not vaccinated. So just a reminder, the MIOSHA rules do not account for vaccination status or an individual recovering from COVID status in terms of what rules would not apply to those individuals. So if we're specifically talking about the MIOSHA rules, there is no distinction between vaccinated, non-vaccinated, folks who are recovering, folks who never had it, right? All of the MIOSHA rules apply regardless of what an individual's status is related to those pieces. The MDHHS order doesn't make that distinction either, right? They classify fully vaccinated and include that group in the list of folks exempted from indoor face covering requirements as people who are 2 weeks post their last shot, right? If they're in a 2-dose series or if they're in the 1-dose series. So there's no account in the MDHHS order related to folks who are recovering from COVID. So no distinction there. Also, a question related to daily entry screenings and social distancing and all of those pieces. Again, right, the MIOSHA order, or excuse me, the MIOSHA rules are unchanged. In fact, they're unchanged from last October. They were extended in April, but I promise you not one word of them changed. And so there's no distinction between vaccinated, not vaccinated status. There's no link to even the MyVac to normal program, right? We anticipate that we'll be seeing some MIOSHA rule revisions, even if it's just related to in-person work, right? We're anticipating that at some point before Monday, May 24th, but we haven't seen that yet. So all of the things that you as an employer have been doing since last October, and even before that, right, before the emergency rules were in place, we had executive orders we were complying with, those have remained unchanged as the MIOSHA rule stands today. So just wanted to clarify those two things.
Okay, great. Thank you, Sandy and Tim. And we do need to conclude the webinar. If you do have specific questions, and I know Sandy and Tim alluded to this before, and especially until we get some more guidance or cohered guidance, maybe we're going to have some confusion and continued issues, of course. So hopefully we'll get that soon. We'll obviously continue to update clients with alerts and through other events, webinars, and the like. In the meantime, please do, as Amy, encourage you, if you have questions specific to your business or your industry, reach out to whether it's a Miller Johnson attorney or another, attorney you work with. Make sure that, as we're hopefully coming out of this pandemic, close strong and don't kind of make a mistake toward the end. So hopefully, as we're winding down some of the restrictions that have been put in place, we'll learn from that process. And say we, I mean, kind of the government and lawyers and the whole ecosystem, kind of like we learned as we were putting in place the orders. I think there's going to be a bit of a learning curve as we're unwinding some of these things too. So your feedback is really much appreciated, and all the great questions, because we can then share that with our team and probably ultimately share that out with the state officials with whom we interact, each week. So thank you for your questions and your attendance. It makes us better attorneys and advocates. And we really sincerely appreciate your time. I hope you have a good week, and stay healthy and safe, and stay in touch with us. Thank you so much. Take care.